Hello, everyone, and welcome to my channel. My name is Rakaya Baker. I am a graduating senior at Hampton University, psychology major. The proposed study will evaluate whether adding foods high in vitamin D during pregnancy prevents schizophrenia in childhood. This design is a quasi-experimental design consisting of a randomized controlled trial experiment. Schizophrenia in children is usually diagnosed by a child psychiatrist. A complete mental health evaluation is conducted to determine individualized treatment needs. The leading treatment for schizophrenia is antipsychotics. Antipsychotics can be taken orally in the form of a pill or given as an injection known as depot. Antipsychotic drugs are antagonists on a number of neurotransmitters. It is hypothesized the use of vitamin D in expecting mothers prevents schizophrenia during childhood as a result of the body's control of the gastrointestinal tract leakage. Vitamin D deficiency is correlated to gastrointestinal disorder symptoms. A study conducted in 2016 reported a significant relationship between vitamin D deficiency and gastrointestinal disorder symptoms. Participants were randomly selected to receive vitamin D3 or a placebo for a period of 6 months. Results showed a significantly greater improvement in irritable bowel syndrome and overall gastro symptoms with the higher levels of vitamin D. 100 pregnant women will be collected from 5 Planned Parenthood clinics in the Washington, D.C., Maryland, and Virginia area. Participants will be selected using a systematic random sampling technique. Participants will be given an oral and written in-depth description of the study. Participants will then be asked to include a list of foods that are high in vitamin D into their diets. Schizophrenia will be measured using a psychological examination with DSM and an fMRI screening. According to the Diagnostic and Statistical Manual of Mental Health Disorders, the 5th edition, to meet the criteria for diagnosis of schizophrenia, the patient must have experienced at least 2 of the following symptoms: delusion, hallucination, disorganized speech, disorganized behavior, or other negative symptoms of schizophrenia. A 25-OH-D blood test will be conducted at the end of each trimester to determine the participant's level of vitamin D intake. After the birth of the child, researchers will measure the child over a 13-year period. A MRI will be performed to provide researchers with imaging of certain regions of the brain associated with schizophrenia. The most recent 7 Tesla MRI model will be used, the Magnum Terra. Participants will come to the local hospital with the child for the MRI scan. During the scan, the room temperature will be set to 74 degrees. During the test, the child will wear a hospital gown and asked to lie on the table. Participants will then be asked to place their head in a brace and to hold still. Then slide head first into the MRI. While the machine is scanning the participant's brain, they will be asked to tap their thumb against each finger to create activity in the hypothalamus. Researchers will focus on measuring brain activity in the frontal lobes and hypothalamus. After the completion of the Diagnostic Statistical Manual for Mental Disorders and the fMRI scan at each cognitive developmental stage, a clinical examination, blood test, and stool analysis are administered to the child to measure the gastrointestinal tract disorder symptoms. A alanine trimesase blood test will be conducted to look for blood count and liver functions. If the liver is damaged, it will release more ALT into the bloodstream and levels will rise. For each stool analysis, a stool sample will be collected in a clean container and sent to the laparoscopic examination. After completing the trial, the general linear regression model will be incorporated to compare the results of the vitamin D deficiency and schizophrenia development in brain.